One of my favorite parts about CBY year is the sense of inclusion that we feel from a very early stage. The faculty and the senior residents go through really great lengths to make sure that we have a smooth transition into residency. And one of the ways they do this is by inviting us to all of the educational and social events that the department has. And so this allows us to start building relationship with the faculty and the upper level residents to develop a sense of camaraderie starting from really early on. We also have monthly clinical-based year lectures where we're excused from our rotations, we can hand the pager off, and we get a lecture on an anesthesia-related topic. It's also a really nice time to catch up with our fellow co-interns, debrief about the month, vent a little, and then learn the logistics of our next rotation, so like where to go, when to show up, things like that. So our program does a really good job at including us in the broad goings on in the department, but also having dedicated lectures just for us. In addition to this sense of inclusion, our rotations themselves actually do a really nice job preparing us for CA1 year. And so my co-residents will talk about that next.
One of the reasons that I think the clinical base year here at UPMC is definitely one of the best in the country is because of how much anesthesiology exposure you have during that intern year. We actually have two specific anesthesiology rotations that you'll be taking as an intern here. The first is your clinical anesthesiology month. And during that rotation, you get to work with senior residents every day in all different ORs, whether it be general, cardiac, neuro, even liver, kidney transplant rooms. And you are part of that anesthesiology care team, performing airway management, practicing your lines, and ultimately getting to know the senior residents, which is an excellent way to be introduced to the program. The second rotation I wanted to talk about was the acute pain rotation. And on acute pain, you're going to work on a perioperative acute pain consult service, going around the hospital, providing multimodal pain management, and also doing a lot of nerve blocks. Many of us will complete all of our graduation required nerve blocks in that first month. So it's an excellent way to get exposure to doing ultrasound, learning how to do nerve blocks. You'll do 1 week of call, which is a great learning experience and a great responsibility. So overall, those 2 months, the anesthesiology rotation and the acute pain rotation, are two of the reasons why our intern year here is so strong.
The APP, or Anesthesiology Professional Practice Rotation, is the most unique rotation of your clinical base year. It primarily revolves around a carefully selected lecture series from a wide range of speakers that address topics in anesthesia outside of the OR. Each day comprises of 15-minute to 1.5-hour lectures, usually from about 8 a.m. to 3 p.m. The types of speakers include your attendings, who discuss the pros and cons of academics versus private practice, business professors who talk about finances and how to bargain for your first salary, malpractice and defense lawyers who talk about how you might get sued and how to protect yourself, engineers and inventors who talk about how you can turn an idea into a patent and product, and also a plethora of researchers who offer opportunities to start projects. The APP rotation is so unique because it brings a lot of value by approaching anesthesia from every angle. However, what many previous residents find as the best part of the rotation is that you get a fully funded trip to the ASA national meeting, even if you don't have a project to present. For me, this was the best part of the rotation, where you get to bond with your classmates and be introduced to other members of the UPMC anesthesia department and all they have to offer.
During your CBY off-service rotations, you have a chance to learn about the UPMC system and prepare you for your clinical anesthesia years. During your 2 medicine months, you have the chance to work up various patients and perform many preoperative evaluations. Your medicine attendings are aware of your specialty and will even gear lectures towards relevant topics. During your cardiology month, you'll have the chance to look at EKGs and interpret them, and also treat various arrhythmias that you may see in the OR. You'll also have the chance to look at echocardiograms and use the ultrasound for point of care use. During your ENT month, you'll have the chance to work with surgical residents and manage airways. The attendings and the residents are extremely nice, and you get to make friends with them, which makes going into the OR much more enjoyable. During your emergency medicine months, you have the chance to see many acute patients with many difficult diseases that require broad differentials and even sometimes immediate treatment. During the blood bank month, which is the best month in my opinion, you have the chance to learn about how the blood bank is run, indications for various transfusions, and also prepare for step 3.
During CBY year, you'll complete 2 months of ICU rotations, which count towards the 4 total months of ICU training during anesthesia residency. You spend 1 month in a surgical ICU taking care of mainly post-surgical patients and 1 month in a medical ICU taking care of a wide range of medical cases. In the surgical ICU, you'll have the chance to work with some attendings who are anesthesia critical care trained, and in the medical ICU, the attendings will be medicine-trained pulmonary crit care. The MICU has didactic sessions which cover a wide range of topics like vent management, shock, and other important ICU topics. Pitt is known for its very strong critical care fellowship, so you'll work with fellows who are excellent teachers and have the chance to see a lot of high acuity cases. The ICU months are great for procedural skills, placing central lines, arterial lines, intubating. And the MICU is the only month of intern year where you take overnight call. So you'll take about 2 or 3 overnight call shifts, and then depending on the ICU that you're at, you may also take a week of night float. Overall, the ICU months were some of my favorites, even though they have long hours. You get to work with teams that are great and practice your procedural skills and gain a lot of great medical knowledge.